April 15, 1945, 043 hours, and Oberschwester Elisabeth Hoffmann, Chief Nursing Officer of the 12th Army Field Hospital near Magdeburg, stands over a critically wounded Oberschwester whose abdominal injuries would be fatal under normal circumstances. Her 15 years of German medical training, rooted in the precision and scientific rigor of European medicine, has prepared her for every battlefield wound imaginable. German nursing doctrine emphasizes methodical wound treatment, careful observation, and the systematic application of proven medical procedures that have served the Reich's military medical service with distinction. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed because tomorrow I've saved something extra special for you. What Oberschwester Hoffmann cannot possibly know, what no German medical professional could imagine in their most desperate moments, is that American medics advancing across the Elbe River carry revolutionary techniques that will make her meticulous German training seem antiquated by comparison. Within hours, she will witness American corpsmen performing miracles with blood plasma, sulfa drugs, and rapid surgical techniques that save lives German medicine has already written off as hopeless. These crude American methods will prove so effective that German medical personnel will abandon generations of traditional European practice to embrace innovations born in American medical schools and perfected on Pacific battlefields. The German military medical establishment's confidence in their superior training and methodology comes from a century of European medical leadership that has produced the world's most advanced surgical techniques, pharmaceutical knowledge, and nursing education. German medical schools like Charité in Berlin and the University of Vienna have trained generations of physicians whose precision and scientific methodology have set global standards for medical excellence. Oberarzt Dr. Heinrich Müller, Chief Medical Officer of the 12th Army Field Hospital and veteran of campaigns from Poland to Stalingrad, embodies the German medical tradition that emphasizes thorough diagnosis, careful treatment planning, and systematic wound management based on established medical principles. His training under Professor Ferdinand Sauerbruch at Charité instilled the methodical approach that German military medicine applies to battlefield casualties. Detailed examination, precise surgical intervention, and careful post-operative monitoring. Preparing and narrating this story took us a lot of time, so if you are enjoying it, like this video. It means a lot to us. Now back to the story. German nursing education, exemplified by Hoffmann's training at the Kaiserin Augusta Victoria Hospital in Berlin, emphasizes technical competence, strict adherence to medical protocols, and the systematic documentation that allows precise treatment tracking. German nurses learn to prepare elaborate wound dressings, maintain detailed patient records, and follow complex medication schedules that reflect the scientific precision German medicine applies to healing. The German pharmaceutical industry has provided military medical units with what they consider the most advanced medications available, including synthetic sulfonamides developed by Bayer and sophisticated analgesics that represent the pinnacle of chemical research. German chemists' development of compounds like Prontosil and various morphine derivatives gives German medical personnel confidence that their pharmaceutical arsenal exceeds anything available to Allied forces operating with presumably inferior industrial support. Schwester Anna Richter, Hoffmann's deputy with 12 years of battlefield nursing experience, has developed techniques for managing complex abdominal wounds using traditional German methods that emphasize careful cleaning, precise suturing, and extended observation periods. Her approach reflects German medical doctrine that prioritizes thoroughness over speed, believing that careful initial treatment prevents complications that rapid intervention might miss.
German surgical techniques, developed through extensive anatomical study and refined through years of battlefield experience, emphasize precise incisions, methodical tissue handling, and systematic wound closure that minimizes scarring and infection risk. German military surgeons pride themselves on achieving healing results that reflect the technical excellence of European medical training, even when treating severe battlefield trauma under primitive conditions. The organization of German field hospitals reflects military efficiency applied to medical care, with clearly defined hierarchies, standardized procedures, and detailed protocols that ensure consistent treatment quality regardless of individual medical personnel. This systematic approach has enabled German medical units to maintain professional standards even during the chaotic conditions of retreat and resupply difficulties. German medical doctrine emphasizes conservative treatment approaches that prioritize patient safety over aggressive intervention, reflecting European medical tradition that views dramatic surgical procedures with suspicion. German physicians prefer gradual healing processes that allow careful monitoring over rapid treatments that might introduce unforeseen complications into complex medical situations. The training of German medical personnel includes extensive theoretical education that provides deep understanding of anatomical structures, physiological processes, and pathological conditions affecting battlefield casualties. This comprehensive knowledge base allows German medical professionals to make informed decisions about treatment options based on established medical principles rather than empirical field techniques. German pharmaceutical protocols require precise dosages calculated according to patient weight, wound severity, and treatment duration, reflecting the scientific approach that German medicine applies to medication administration. This methodical approach prevents overdosing and adverse reactions that might result from the improvised treatments that German medical personnel assume characterize American field medicine. The German Military Medical Service has developed specialized equipment for field operations that reflects precision engineering applied to medical instruments. German surgical tools, manufactured to exacting specifications by companies like Aesculap, provide the technical quality that German medical procedures require for optimal results under battlefield conditions. Quality control in German medical units emphasizes documentation and review procedures that ensure treatment decisions meet professional standards established by German medical education. This systematic approach to medical care reflects the scientific methodology that German medical personnel believe distinguishes their practices from the presumably inferior techniques employed by American military medical units.
What German medical intelligence networks have completely failed to detect is the revolutionary transformation occurring in American military medicine, driven by innovations developed in civilian hospitals, medical schools, and pharmaceutical laboratories across the United States. American military medical doctrine has undergone fundamental changes based on lessons learned from Pacific theater operations, producing techniques that prioritize rapid intervention and aggressive treatment over the conservative approaches favored by European medical tradition. The development of blood plasma as a battlefield resuscitation tool represents one of the most significant advances in trauma medicine, pioneered by Dr. Charles Drew at Columbia University and refined through Red Cross blood banking programs that enable mass production of plasma for military use. American medical units carry plasma in quantities that allow immediate treatment of shock and blood loss, conditions that German medical doctrine addresses through careful observation and gradual fluid replacement. American pharmaceutical advances, particularly the mass production of sulfa drugs and the revolutionary new antibiotic penicillin, provide American medics with infection-fighting capabilities that exceed anything available to German medical personnel. The Pfizer company's development of deep tank fermentation techniques enables penicillin production in quantities that make the antibiotic available for routine battlefield use, while German medical units rely on limited quantities of sulfonamides that require careful rationing. The concept of forward medical treatment, developed through American experience in Pacific Island campaigns, emphasizes rapid surgical intervention as close to the battlefield as possible, rather than the German practice of evacuating wounded to rear-area hospitals for definitive treatment. American mobile surgical hospitals can perform life-saving operations within minutes of casualty occurrence, preventing the deterioration that often occurs during German evacuation procedures. American medical training emphasizes practical skills and rapid decision-making over the theoretical knowledge that German medical education prioritizes. American medics learn to perform emergency procedures using simplified techniques that achieve effective results without requiring the extensive anatomical knowledge that German medical protocols demand. This pragmatic approach enables faster treatment that often proves more effective than methodical German procedures.
German medical training's emphasis on understanding disease processes and anatomical structures, while intellectually superior, does not prepare medical personnel for the improvisational techniques required when proper equipment and supplies become unavailable. German medical personnel struggle to adapt established procedures to primitive conditions, while presumably less educated American medics might prove more flexible in their treatment approaches. The German concept of medical professionalism, which emphasizes adherence to established protocols and systematic approaches, becomes problematic when battlefield conditions require immediate action based on limited information. German medical personnel hesitate to deviate from proven procedures, even when circumstances suggest that alternate approaches might prove more effective for specific patients. German medical ethics, rooted in European concepts of medical responsibility and patient care, create conflicts when limited resources force medical personnel to make triage decisions that European medical training does not address adequately. The systematic approach that German medical education emphasizes provides little guidance for situations where medical personnel must choose which patients receive limited treatment resources. The documentation requirements that German medical procedures demand consume time and personnel that battlefield conditions cannot spare. German medical units maintain detailed records that reflect their professional training, but this administrative burden reduces the time available for direct patient care when maximum efficiency becomes essential for saving lives. German medical personnel find themselves increasingly isolated from medical advances that might improve their treatment capabilities. The systematic medical research that German universities conducted during peacetime has been disrupted by wartime conditions, leaving German medical personnel without access to innovations that continued medical research might have produced. Supply shortages forced German medical units to reuse equipment that single-use protocols would normally require replacing, creating infection risks that compromise patient outcomes. German medical personnel must balance infection control procedures against resource limitations that make ideal medical practices impossible to maintain under current circumstances.
Within 48 hours of American capture of the German field hospital, patient outcomes demonstrate the revolutionary effectiveness of American medical techniques in ways that challenge every assumption German medical personnel hold about proper medical care. Patients whom German medical protocols had classified as terminal showed dramatic recovery following American treatment using methods that German medical training would consider dangerous or inappropriate. Oberschwester Hans Eber, suffering from severe abdominal wounds that German medical assessment indicated would prove fatal within days, receives American treatment involving immediate surgical intervention, aggressive blood replacement, and penicillin administration in dosages that German protocols would consider excessive. Within 24 hours, Weber shows improvement that German medical experience suggested was impossible given his initial condition. "This cannot be happening," Hoffmann confides to Schwester Richter as they observe Weber's remarkable recovery. "Everything we learned about wound treatment suggests that American methods should kill patients, not cure them.
How are they achieving results that our carefully planned treatments cannot match? American pharmaceutical applications produce results that contradict German medical understanding of proper drug administration. Patients receiving American antibiotic treatments show infection resolution in timeframes that German medical literature suggests require weeks of careful treatment. The aggressive dosaging that American protocols employ appears to overwhelm infections that German conservative treatment approaches cannot control effectively. Captain Thompson's surgical results astound Dr. Müller, whose German medical training emphasized careful technique and precise anatomical knowledge as prerequisites for successful operations. The American surgeon's rapid procedures, which prioritize functional restoration over cosmetic results, achieve healing outcomes that exceed anything Müller has accomplished through methodical German surgical techniques. Blood plasma applications that American medics perform routinely produce patient stabilization that German medical personnel have never witnessed. Patients suffering from shock and blood loss respond to American plasma treatment with rapid improvement that German medical protocols, emphasizing gradual fluid replacement, cannot achieve. The American approach appears to reverse physiological deterioration that German medicine would consider irreversible. The American medical team's treatment of German medical personnel themselves demonstrates techniques that challenge German understanding of infection control and wound healing. Hoffmann receives treatment for a hand injury using American methods that achieve healing in days rather than the weeks that German medical protocols would require for comparable injuries. The American medical team's response to critically wounded German soldiers demonstrates treatment capabilities that German medical personnel have never witnessed. Technical Sergeant Patricia Collins, an Army nurse from Detroit, administers penicillin injections to patients with infected wounds that German medical protocols would treat through careful wound cleaning and limited sulfonamide application. Within hours, patients whom German medicine had classified as terminal showed dramatic improvement. American blood transfusion procedures shock German medical personnel through their apparent disregard for safety protocols that German medical training considers essential. American medics perform direct blood transfusions using simplified typing procedures that achieve effective results without the extensive compatibility testing that German medical doctrine requires. Patients who would have died from blood loss under German conservative treatment show rapid improvement following aggressive American blood replacement. Dr. Müller observes American surgical techniques that violate every principle of German medical training, yet achieve results that exceed anything he has accomplished through methodical German procedures. American Army surgeon Captain James Thompson performs emergency abdominal operations using techniques that prioritize speed over precision. Yet his patients show better survival rates than comparable German cases treated through traditional methods. The American medical supply abundance astounds German medical personnel accustomed to rationing every medication and medical supply. American medics use disposable equipment that German medical units would carefully clean and reuse, administer medications in quantities that German protocols would consider wasteful, and employ medical supplies without the careful inventory management that German medical procedures require. American medical documentation procedures appear chaotic compared to German systematic record-keeping, yet American medical personnel achieve treatment coordination that equals or exceeds German organizational efficiency. American medics maintain abbreviated patient records that focus on treatment outcomes rather than the detailed documentation that German medical training requires as evidence of professional competence. The integration of American medical personnel with combat units demonstrates medical organization concepts that German medical doctrine has never considered. American medics operate at company level with equipment and training that enables immediate treatment, while German medical organization requires evacuation to battalion or regiment-level facilities before definitive care becomes available. American medical protocols allow enlisted personnel to perform procedures that German medical training restricts to qualified physicians.
Yet American treatment results suggest that simplified techniques can achieve effective outcomes without requiring extensive medical education. This democratization of medical procedures challenges German concepts of medical professionalism and training requirements. The American emphasis on patient survival over procedural correctness creates ethical conflicts for German medical personnel trained to follow established protocols regardless of circumstances. American medics focus on achieving positive patient outcomes through whatever methods prove effective, while German medical training emphasizes adherence to proven procedures even when alternative approaches might prove more successful.
On April 20, 1945, the sound of American tank engines approaching the 12th Army Field Hospital near Magdeburg creates panic among German medical personnel, who have heard rumors of Allied treatment of captured Wehrmacht medical units. Oberschwester Hoffmann faces the decision of whether to evacuate her patients or remain to provide medical care despite the risks associated with capture by American forces, whose medical practices German intelligence has consistently characterized as inferior to German standards. The first American soldiers to enter the German field hospital are medics from the 9th Infantry Division's Medical Battalion, led by Staff Sergeant Robert Martinez, a former ambulance driver from Los Angeles whose medical training occurred entirely through Army programs rather than civilian medical education. His approach to the German medical facility reflects American military medicine's emphasis on rapid assessment and immediate treatment, rather than the methodical evaluation that German medical procedures require. "Jesus Christ," Martinez mutters as he surveys the German hospital's patients, many of whom display wounds that American medical doctrine would have treated immediately, but which German medical protocols required careful observation before intervention. The difference between American aggressive treatment and German conservative approaches becomes immediately apparent through patient conditions that American medical personnel consider preventable through proper pharmaceutical intervention. Hoffmann watches with professional curiosity as American medics begin treating German wounded using techniques that violate every principle of German medical training. The Americans administer blood plasma without the careful typing procedures that German medicine requires, inject medications in dosages that German pharmaceutical protocols would consider dangerous, and perform surgical procedures without the sterile preparation that German medical training emphasizes as essential for preventing infection. "Your patients are dying from treatable conditions," Sergeant Martinez explains through a German-speaking American medical officer. "We can save them, but we need to use our methods immediately." The statement challenges fundamental assumptions about medical competence that German medical training has instilled, suggesting that American techniques might achieve better results than established German medical procedures. As spring 1945 progresses, German medical personnel who have witnessed American medical techniques face a profound professional transformation that extends beyond individual patient care to fundamental questions about medical education, professional practice, and national identity. The techniques that seemed crude and dangerous now represent the future of medical care, forcing German medical professionals to choose between traditional methods and superior American innovations. But this medical revolution represents only the beginning of a transformation that will reshape European medical practice for generations. How will German medical institutions adapt to incorporate American advances? What happens when European medical education must acknowledge American superiority in fields where German expertise had seemed unquestionable? The confrontation between German medical tradition and American medical innovation creates a professional crisis for German medical personnel whose entire professional identity has been built around the superiority of German medical training and systematic approaches to patient care. Oberschwester Hoffmann faces the choice between maintaining professional loyalty to German medical methods or adopting American techniques that demonstrate superior patient outcomes. "I cannot ignore what I am witnessing," Hoffmann writes in her personal journal on April 25, 1945. "American medical methods that I was trained to consider primitive and dangerous are saving lives that German medical procedures would lose. My professional obligation to patient welfare requires me to learn these techniques regardless of their challenge to German medical doctrine." Dr. Müller's professional transformation proves even more dramatic as he requests instruction in American surgical techniques that achieve results he cannot match through German methods. His request to observe American surgical procedures represents an acknowledgement that German medical superiority, which formed the foundation of his professional identity, may be based on incomplete understanding of optimal medical treatment. Schwester Richter begins incorporating American wound treatment techniques into her patient care, abandoning German protocols that require extensive preparation time in favor of American methods that achieve faster healing with less complicated procedures. Her adoption of American techniques creates conflicts with German medical personnel, who view such changes as professional betrayal. The German medical staff's gradual adoption of American pharmaceutical protocols demonstrates the practical benefits of abandoning traditional German conservative approaches in favor of American aggressive treatment methods. Patients respond to American medication regimens with improvement rates that German medical personnel cannot achieve through traditional European pharmaceutical approaches. American medical personnel's willingness to teach their techniques to German medical professionals reflects a professional generosity that contrasts with German medical tradition's emphasis on protecting professional knowledge and maintaining hierarchical distinctions. American medics share their expertise freely, enabling German medical personnel to acquire skills that improve their treatment capabilities immediately. The integration of American medical supplies into German medical procedures enables treatment approaches that resource limitations had previously made impossible. German medical personnel discover that American supply abundance allows optimal patient care that German wartime conditions had forced them to abandon due to material shortages. German medical personnel's documentation of American techniques for future use demonstrates their recognition that American medical advances represent systematic improvements rather than temporary expedients. The careful recording of American procedures indicates German medical professionals' intention to continue using these techniques after the immediate crisis ends. Professional relationships between German and American medical personnel develop based on shared commitment to patient welfare rather than national loyalties. The common medical mission transcends political divisions, creating cooperation that enables knowledge transfer and mutual professional respect despite wartime circumstances. The psychological adjustment required for German medical personnel to adopt American techniques involves abandoning professional pride in favor of patient outcomes. This transformation challenges personal identity issues while requiring acknowledgement that German medical training may have been incomplete or inferior in specific areas of medical practice.
By May 1945, as word spreads throughout captured German medical installations across Europe, a remarkable transformation begins as German medical personnel systematically document and integrate American medical techniques that have proven superior to traditional European methods. Oberschwester Elisabeth Hoffmann, now working alongside American medical personnel at the reorganized Magdeburg facility, has begun training other German nurses in American techniques that achieve patient outcomes impossible through conventional German medical protocols. The documentation process reveals the comprehensive nature of American medical advances across multiple disciplines. American blood banking techniques enable transfusion procedures that German medical training had considered too dangerous for routine use. Yet American protocols achieve survival rates that exceed German conservative approaches by significant margins. The systematic typing and cross-matching procedures developed by American blood banks eliminate transfusion reactions while enabling aggressive blood replacement therapy. Dr. Heinrich Müller's detailed analysis of American surgical procedures identifies techniques that achieve functional restoration with reduced operative time and improved healing outcomes. American surgical philosophy emphasizes rapid intervention and practical results over the anatomical precision that German surgical training prioritizes. This approach enables treatment of patients who would be considered inoperable under German surgical protocols due to time constraints or resource limitations.
American medical supply management demonstrates logistics approaches that ensure material availability for optimal treatment protocols. German medical personnel learned that American supply chains deliver medical materials in quantities that enable routine use of advanced treatments, while German medical units had been forced to ration essential supplies due to logistics limitations and industrial constraints. The psychological impact of witnessing American medical effectiveness creates professional transformations that extend beyond individual technique adoption to fundamental changes in medical philosophy and patient care approaches. German medical personnel begin questioning whether their emphasis on theoretical knowledge and systematic procedures had actually hindered patient care compared to American practical approaches. Training programs developed by American medical personnel for German colleagues reflect educational philosophies that prioritize skill development over academic knowledge. American medical training emphasizes hands-on experience and rapid competency development rather than the comprehensive theoretical education that German medical schools require, yet produces medical personnel capable of achieving superior patient outcomes. German medical personnel's letters and reports document their recognition that American medical advances represent systematic improvements across multiple medical disciplines, rather than isolated innovations in specific treatment areas. This comprehensive American medical superiority suggests that German medical education and practice may require fundamental restructuring to incorporate American knowledge and approaches. The collaborative relationships developing between German and American medical personnel transcend national divisions through shared commitment to patient welfare and professional excellence. These relationships enable knowledge transfer that benefits both medical traditions, while establishing foundations for post-war medical cooperation and continuing professional development.
Throughout the summer of 1945, as German medical personnel return to civilian practice or continue working with Allied medical units, American medical techniques spread rapidly through German medical institutions, creating a transformation that challenges traditional European medical education and practice. Former Wehrmacht medical personnel become advocates for American medical methods that they have witnessed saving lives that German medical tradition would have considered hopeless. Professor Wilhelm Hartmann, chief of surgery at Charité Hospital in Berlin, receives detailed reports from former military medical personnel describing American surgical techniques that achieve results exceeding anything possible through traditional German methods. His initial skepticism transforms into professional interest as evidence accumulates that American approaches represent genuine medical advances rather than wartime expedients or inferior alternatives to German precision medicine. The documentation arriving from former German military medical personnel provides systematic evidence of American pharmaceutical superiority, particularly regarding antibiotic applications that eliminate infections resistant to German sulfonamide treatments. Penicillin availability in American medical units enabled treatment of conditions that German medical practice considered incurable, while American production capabilities ensure adequate supplies for routine therapeutic use. German medical schools begin receiving reports from faculty members who served with military medical units describing American medical training methods that produce competent medical personnel in shorter time frames than German medical education requires. American medical schools' emphasis on practical training and clinical experience appears to develop treatment capabilities more effectively than German theoretical approaches, despite requiring less comprehensive academic preparation. The German pharmaceutical industry faces evidence that American drug development and production capabilities exceed European achievements in both therapeutic effectiveness and manufacturing scale. American companies' ability to mass-produce penicillin, develop improved sulfa compounds, and create standardized pharmaceutical protocols demonstrates industrial medical capabilities that German chemical companies cannot match under current circumstances. Hospital administrators throughout Germany receive reports of American medical organization methods that achieve treatment efficiency exceeding German systematic approaches while maintaining patient care quality. American hospital management techniques appear to optimize resource utilization and personnel deployment in ways that German medical administration had not considered possible through alternative organizational structures. The psychological impact on German medical education establishments proves as significant as the practical implications of American medical superiority. German medical schools, whose curricula emphasized European medical tradition and German medical leadership, must acknowledge that American medical education and practice have achieved superior results in multiple medical disciplines. Medical journal publications in Germany begin featuring articles analyzing American medical techniques and their potential applications to German medical practice. These scholarly assessments acknowledge American medical advances while attempting to integrate American knowledge with traditional German medical approaches, creating synthesis approaches that combine the best elements of both medical traditions. German medical personnel returning from American medical facilities carry detailed knowledge of American techniques along with American medical supplies that enable demonstration of American methods to civilian colleagues. These informal training sessions spread American medical knowledge throughout German medical institutions while providing practical evidence of American medical effectiveness. Professional medical societies in Germany begin organizing conferences and educational programs focused on American medical techniques that former military medical personnel have documented as superior to traditional German approaches. These professional development programs acknowledge that German medical practice must incorporate American advances to maintain medical competency and patient care standards. The transformation occurring in German medical practice reflects broader changes in European understanding of medical knowledge and professional competency. The recognition that American medical methods represent genuine advances rather than inferior alternatives challenges European assumptions about medical superiority and professional excellence that had persisted since the 19th century. The integration of American medical techniques into European medical practice creates lasting changes that transform medical education, pharmaceutical development, and patient care approaches throughout the continent. German medical institutions that had represented the pinnacle of European medical achievement must acknowledge American medical superiority while adapting their curricula and practices to incorporate American medical knowledge and techniques. Medical school curricula undergo fundamental revision as German medical educators recognize that American practical approaches achieve better patient outcomes than traditional European theoretical emphases. The integration of American clinical training methods, pharmaceutical protocols, and surgical techniques requires restructuring medical education that had remained essentially unchanged since the late 19th century. The German pharmaceutical industry begins collaboration with American companies to acquire knowledge and production capabilities for manufacturing penicillin and other antibiotics that American medical research has developed. This technology transfer represents acknowledgement that American pharmaceutical research has achieved advances that German chemical expertise had not accomplished despite decades of leadership in chemical science and drug development. Nursing education programs throughout Europe adopt American training methods that enable nurses to perform medical procedures previously restricted to physician supervision. This democratization of medical responsibilities reflects American medical philosophy that prioritizes patient outcomes over professional hierarchies, creating more efficient medical care delivery while improving treatment accessibility. German medical research institutions establish exchange programs with American medical schools and hospitals to enable German medical personnel to study American techniques directly. These professional exchanges facilitate knowledge transfer while enabling German medical professionals to observe American medical practice under optimal conditions, rather than the wartime circumstances that initially revealed American medical superiority. The transformation of European medical practice influences medical development in other countries as recognition of American medical advances spreads through international medical communities. Medical professionals throughout Europe and other continents begin studying American medical methods while adapting American techniques to local medical practice and educational systems. Hospital management practices across Europe incorporate American organizational techniques that optimize resource utilization and improve patient care efficiency. American hospital administration methods demonstrate approaches to medical organization that achieve better patient outcomes while reducing operational costs and improving staff productivity through systematic management improvements. The psychological transformation of European medical professionals reflects broader changes in understanding medical competency and professional excellence. The acknowledgement that American medical methods represent genuine advances rather than inferior alternatives challenges European medical pride while encouraging adoption of techniques that improve patient care regardless of their national origins. Medical equipment manufacturing in Europe begins incorporating American design principles and production methods that enable mass production of medical supplies and instruments. American medical equipment philosophy emphasizes functionality and availability over precision craftsmanship, enabling widespread access to medical tools while maintaining therapeutic effectiveness. Professional medical literature throughout Europe features increasing coverage of American medical techniques and their applications to European medical practice. These scholarly publications acknowledge American medical advances while providing technical guidance for European medical professionals seeking to integrate American methods into their practice and training. The development of international medical cooperation reflects recognition that medical knowledge transcends national boundaries and that patient welfare benefits from sharing medical advances regardless of their origins. American medical techniques become part of international medical practice through systematic knowledge transfer and professional cooperation that continues beyond immediate post-war reconstruction efforts. European medical legislation begins incorporating American medical standards and protocols that have demonstrated superior patient outcomes. Legal recognition of American medical methods enables their official adoption while providing regulatory frameworks that ensure proper implementation and quality control in European medical institutions. The individual stories of German medical personnel who witnessed and adopted American medical techniques reveal profound personal and professional transformations that extend beyond technical knowledge to fundamental changes in medical philosophy, professional identity, and understanding of patient care responsibilities. These personal narratives demonstrate how exposure to superior medical methods creates lasting changes in medical practice and professional values. Oberschwester Elisabeth Hoffmann's post-war career reflects her complete adoption of American medical approaches that she witnessed during the final months of the war. Her work establishing nursing training programs in post-war Germany incorporates American nursing education methods that emphasize practical skills and independent medical decision-making rather than traditional German hierarchical nursing roles that limited professional responsibility and patient care capabilities. Dr. Heinrich Müller's transition to civilian medical practice demonstrates his integration of American surgical techniques that achieve better patient outcomes than traditional German methods he had practiced throughout his career. His detailed documentation of American surgical procedures enables him to train other German surgeons in techniques that improve patient survival rates while reducing operative time and postoperative complications. Schwester Anna Richter's development of wound care protocols for German civilian hospitals reflects her adoption of American treatment methods that achieve healing rates exceeding traditional German wound management approaches. Her training programs for German nursing personnel spread American wound care techniques throughout German medical institutions while providing evidence of superior treatment outcomes. German medical personnel who worked with American medical units during the post-war occupation period continue advocating for American medical methods throughout their professional careers. Their testimonials provide continuing evidence of American medical superiority while encouraging other German medical professionals to study and adopt American techniques that improve patient care. The psychological adjustment required for German medical professionals to acknowledge American medical superiority creates personal growth that extends beyond professional development to broader understanding of knowledge and cultural exchange. These individuals become advocates for international medical cooperation while maintaining respect for valid elements of German medical tradition. Personal correspondence between German and American medical personnel who worked together during wartime demonstrates lasting professional relationships that transcend national boundaries. These relationships facilitate continuing medical knowledge exchange while providing networks for ongoing professional development and medical technique refinement.
Surgical outcome studies documenting results achieved through American surgical techniques provide statistical evidence of superior patient survival rates and reduced postoperative complications compared to traditional German surgical methods. These clinical studies offer scientific validation for adopting American surgical approaches while providing technical guidance for proper implementation. Infection control studies documenting American antibiotic protocols demonstrate the effectiveness of American pharmaceutical approaches in treating conditions that German medical practice had considered incurable or requiring extended treatment periods. These clinical studies provide scientific evidence for adopting American antibiotic protocols while validating American pharmaceutical development capabilities. Educational research comparing American and German medical training methods demonstrates the effectiveness of American practical approaches in developing medical competency compared to German theoretical emphasis. These educational studies provide evidence for reforming German medical education while validating American medical training philosophy. Quality control studies of American medical supply management demonstrate the effectiveness of American logistics approaches in ensuring material availability for optimal medical treatment. These operational studies provide evidence for adopting American medical supply protocols while validating American approaches to medical resource management. Long-term follow-up studies of patients treated using American medical techniques provide evidence of sustained therapeutic benefits that exceed results achieved through traditional German medical approaches. These longitudinal studies offer compelling evidence for adopting American medical methods while documenting their long-term effectiveness and safety.
German medical personnel's memoirs and professional writings document their recognition that American medical methods represent systematic advances rather than isolated innovations. These personal accounts provide historical evidence of the transformation process, while encouraging other medical professionals to remain open to medical advances regardless of their origins. The career trajectories of German medical personnel who adopted American techniques demonstrate professional success that validates their decisions to abandon traditional German medical approaches in favor of superior American methods. Their professional achievements provide evidence that adopting American medical techniques enhances rather than compromises medical competency and patient care capabilities. Family histories of German medical personnel reveal intergenerational transmission of American medical knowledge as parents train their children in medical approaches that combine German theoretical knowledge with American practical techniques. This knowledge transmission ensures continuation of medical improvements while creating medical dynasties that value international medical cooperation. German medical personnel who emigrated to other countries after the war carried American medical techniques they had learned to new locations, spreading American medical knowledge throughout international medical communities.
Their contributions to medical practice in various countries demonstrate the global impact of American medical innovations beyond their original wartime applications. Professional recognition received by German medical personnel who adopted American techniques validates their professional judgment while encouraging other medical professionals to study American medical methods. Awards and professional honors acknowledge their contributions to medical advancement while providing evidence of the value of international medical knowledge exchange. The teaching careers of German medical personnel who learned American techniques enabled them to train new generations of medical professionals in methods that achieve superior patient outcomes. Their educational contributions ensure that American medical advances become integrated into ongoing medical education rather than remaining isolated wartime experiences.
The transformation of German medical personnel from confident practitioners of supposedly superior European medical techniques to advocates for American medical methods represents a microcosm of the broader shift in global medical practice that established American medical innovations as international standards for patient care, medical education, and pharmaceutical development. The personal stories of German nurses and physicians who witnessed American medical effectiveness demonstrate that professional excellence requires openness to superior techniques regardless of their origins, while patient welfare must take precedence over professional pride or national medical traditions. These individual transformations created lasting changes that influenced medical practice for generations beyond the immediate wartime period. The scientific documentation of American medical superiority by German medical professionals provides objective evidence that validates the adoption of American techniques while offering technical guidance for proper implementation. This scientific validation ensures that medical practice changes are based on evidence rather than political considerations, creating lasting improvements in patient care and medical education. The global spread of American medical techniques through German medical personnel who experienced their effectiveness demonstrates how medical knowledge transcends national boundaries when it demonstrably improves patient outcomes. This knowledge transfer created international medical standards that continue influencing medical practice decades after their initial development and implementation. The integration of American medical methods into German medical practice while preserving valuable elements of German medical tradition demonstrates that medical advancement benefits from combining the best elements of different medical cultures rather than completely replacing one system with another. This synthesis approach created medical practices that exceed the capabilities of either individual medical tradition. The lasting impact on medical education philosophy reflects the recognition that practical skills and clinical experience produce medical personnel better prepared for patient care than purely theoretical knowledge, while maintaining the importance of scientific understanding and systematic approaches to medical practice. This educational balance continues influencing medical training throughout the world. The transformation of European medical practice through adoption of American techniques while maintaining European contributions to medical science demonstrates that medical advancement benefits from international cooperation and knowledge exchange rather than national competition or professional isolation. This collaborative approach continues characterizing modern international medical research and practice. The recognition that American medical innovations represented systematic advances rather than isolated techniques validated American approaches to medical research, education, and practice, while establishing foundations for American medical leadership that continues influencing global medical development. This leadership role reflects demonstrated capability rather than political or economic dominance. The personal and professional growth experienced by German medical personnel who adopted American techniques demonstrates that medical professionals benefit from remaining open to new knowledge and techniques throughout their careers rather than relying solely on initial training. This attitude of continuing professional development characterizes modern medical practice and professional standards. The ultimate legacy of German medical personnel who adopted American techniques lies in their contribution to improving patient care through evidence-based adoption of superior medical methods, regardless of national origins or professional traditions. Their example continues inspiring medical professionals to prioritize patient welfare over professional pride while remaining open to medical advances that improve treatment outcomes and save lives.